Good evening, Julie. How are you
Good
today?
evening, Christine. How are you?
I'm good, and you?
Very good. Very good.
That's good. It is April the 4th, 2023 today, and we're going to talk a bit about addiction and mental health issues that are on the streets and what you're seeing.
Yeah.
And I understand, like I said, we've had a lot of trouble up in 454 with mental health issues. But now I'd like to talk to you because now you have a friend who's in the hospital with addiction and mental health issues.
Yes, exactly.
And
I got so many, but he's one of them.
Yes, he's one of them.
Yeah.
And I'd like to know more about this gentleman. You said he's been on the streets now for about how long?
3 years now, and he's been doing drugs for a couple of years on the street too, and he has mental problem, and he likes to put fires everywhere downtown in the garbage can, and just to get the attention from the cops, and yeah.
Well, from what I understand, he got the attention in what way?
And the wrong way.
In the wrong way.
Yes. Yeah.
Yes, apparently they got him on camera setting a fire from what
So many times last summer and this year a couple times too. Yeah.
Yeah, I understand right now that he's in the hospital.
Yeah. Yes, he is. He's on Montfort. Yes.
Well, how's he doing?
It's hard to say. Some days he's good. Some other day he's not stable. Some days he's okay. Some day, so it depends.
It depends. Like
Yes, it's up and down at the hospital too. So.
Yeah, it's up and down at the hospital.
Yeah, but I brought him candies the last time just to calm his nerves. Because he wanted to smoke all the time. I said no. I said no cigarettes. But you know what? I'll buy you candies. So I think he's having fun and just eating candies around and just walking around the hospital and helping himself. I hope.
Well, I hope he's helping himself, but
I hope too. I pray God.
What you said when he first came down, you met him, and he got caught up in the drug trap down here.
Correct. Yes.
So do you know how he got involved in the drug trap?
Oh my God, dealing. Yeah, dealing. The dealers after him. He got sucked in a pretty good, for his good looks, or I don't know, or maybe he had some money before, but he really got sucked in, Christine. Yeah, pretty bad.
Yeah, so it's very easy for them to get sucked in.
Very easy, and especially him. He's so influenced a lot of times. So yeah.
So how old about roughly is this?
Oh my God! Well, he's a little bit younger than me, but yeah, he's about, my God, 43, 44 years old.
And so he must have been in a lot of trouble before if he had mental health problems even before he came.
I'm pretty sure with his sister, yes, in Rockland. Yeah, he had problems. So yeah, so she threw him out so many times. He went back to his sister. It didn't work there. Went back to the Shepherd. It didn't work there. So he's always back and forth, jail, and mental problems, and then so back to the shelter, back and forth all the time.
Yeah, and definitely back and forth to the hospital all the time. And why does he tell you he likes to go to the hospital?
Oh my God! Because he likes to eat and he likes to talk with people and the other patient, and he has a comfortable bed at night. He doesn't need to come here and get harassed here at the shelter, back and forth all the time. So yeah.
So how is he getting harassed at the Shepherds?
Oh my God! For the drugs, he owes money supposedly. Oh my God! He's always doing drugs there. He's always falling.
So he feels far safer in the hospital then.
Yeah. That's what he told me the last time too. I just feel safe, Julie, here. I love it. I want to stay here longer. So he loves it. Yeah, he likes the hospital more than the Shepherds. Yeah, he does.
Well, it sounds like he gets much better treatment at the hospital.
Correct. Exactly. He feels more safe, and the treatment is working really good for him. Yeah.
So how long has this been going on? You said he's been in and out of the hospital
for 2 years. Almost 2 years. Yeah. On and off.
On and off?
Yeah. Street hospital, jail, back and forth all the time. Yeah.
So it seems to me that what I'm hearing as well, it's almost a revolving door between most of the street people, because I'm hearing that's where they don't feel safe at the Shepherds or at the shelters, so they feel better at the hospitals.
Exactly. At the hospital or in jail.
Or in jail.
So jail, hospital, they feel more safe in there, and they feel, like more protected. So yeah.
Well, that's very interesting, what you're saying. But it's also, I'd be interested in certainly knowing, because we have so many out there, like we have to call, all our first responders have to respond to all the calls they're getting down here. So that's expensive at the taxpayers'
For the
money.
Exactly.
Then if they want to go in the hospital, they go and get a little vacation in the hospital at the taxpayers' expense again.
Exactly, but they get thrown again. So oh, gee, I'm still back on the street. So he's always like back and forth all the time. So jail, hospital, and the streets. And he gets all mixed up. Emotionally, he gets frustrated about it. And there's no help for him. But I hope this time they got him good.
Well, from what you said, you've been talking to him, and he said that he's going into
detox.
Detox,
Yeah.
Supposedly. Is this
supposedly? Yeah. But he likes to lie sometimes. But I think the doctor is going to put him straight there. After the hospital. So he's going to go right straight to the detox. Yeah, if there's a bed for him available. So I hope there's one.
Well, that's always the problem: is the beds available? We don't have enough in mental health.
Or detox or the streets. Yeah. So they have to wait.
Does he have a mental health worker at all?
Yes, he does at the hospital right now. Yeah, he does. Doctor, mental health worker. A CMHA worker. So yeah, he's pretty. He's pretty secured around those people right now. Yeah, he has the help that he needs right now. I hope.
So it sounds like all these people, he feels safer with these people, the doctors and everything.
Nurses around him all the time.
Yeah.
He likes the treatment there. Yeah, he does.
He loves the treatment. In other words, he's getting the VIP treatment.
The VIP treatment.
Because he's not getting the VIP treatment at the Shepherds.
No, not at all.
Not at all.
There's no help for him. No, and he overdosed 3 times on the street too. So,
and he came out of that?
He came out of that.
Did he ever learn anything from overdosing?
No, not at all. No, never.
So it's because I believe you also were mentioning about him when he comes out, he likes all the excitement of what's going on. And
all the time. Around here and everywhere he goes. Oh my God, downtown, I'm back. Right on, this is my fun time. No, there's no more fun, okay? It's going to be your okay? It is going to be your life here, okay? But like, no, sorry, he is going to die on the street.
Well, it sounds like it if he doesn't take the detox and smarten up that he's going to end up definitely ODing or ending up dead on the streets.
Exactly, like the other ones around, yeah.
It's such a shame that we're having all this problem with all these ODs.
Too much opioids or ODs. Too much down here. Too much.
But it seems like they're really actually knowing how to milk the system here is what I call it.
Big time. They take advantage of the system,
At the taxpayer's expense.
Yeah, especially him. He doesn't need the, he needs more treatment than get in the hospital. Just keep there. I don't know. So the hospital for him, it's more safe. Yeah, but he needs more treatment. You know what I mean? Mm-hmm. Yeah. So like detox, but he's not ready to go there yet. But there's no beds either. Christine.
I know. Well, this is what I'm saying. We have a shortage of everything, but our system is failing. All these people, everyone.
Everyone, yeah, everywhere.
The system's failing the taxpayers because we're having to pay out all this money. We're failing those that are in mental health and addiction issues, and
they're all stuck in the same gamut thing, yeah.
And this is what we were finding, and the whole point is everybody just says, well, here you can have your needles, you can have your pipes, whatever you need. So we're really yes, and this is not really helping.
No, it's not. They did almost everything.
The policies that our government's put in place are not working. We have to come up with something better.
Exactly. And he's been fighting with the security guard a couple times too at the hospital. So he likes to fight the security guard at the hospital too. He said, Julie, I've been fighting so long with them. I said, really? Do you feel proud about it? He said no.
So what's he fighting with the security about?
Yeah. Well, yeah. He just wants to run away. From the hospital all the time.
So he's not. He's trying to run from the hospital and
back and forth all the time fighting with the security guards. Yeah.
So he's desperate for his drugs, I guess.
That too. Down here, yeah. So he wants to go downtown.
But he can't have it both ways. You cannot have your drugs and be down here and have the VIP treatment at the hospital at the same time.
Exactly. But he wants both. He wants everything at the same time. Oh my God, everything for me.
But that's the way the system has put it in place, where everyone can get everything they want, and it doesn't matter. They can have what I call we have children who have can have a 2-year-old temper tantrum, and screaming and stamping their feet and
Yeah, that's what he's doing.
yeah, and it might be over. The child might be over a simple thing as a ball. And what do? You take the ball away, and how do you correct the child? You either give the child a timeout, or you take away a privilege. But these drug addicts, it used to be that if, and I'm not seeing it anymore, that when I was in Hindenburg, of course, we used to take if you got a needle, to get another needle, clean needle, you had to exchange the old needle, but they're not doing that.
No.
And that was the way the needle boxes were, but they're not being put in the needle boxes either.
Exactly.
And we were against those too.
Yeah, we're against those too. Yeah.
So I don't want to make the video too long tonight, but I just wanted to bring up some of this, and I think it was good of you to talk about it, friend, just a demise, and just to see, my viewers can see just how bad this revolving door is that we have. That
there's no help for them. There's no help for them.
No, there's no help for them. Period.
He's like a yo-yo, going back and forth. But it's not good for his health problem either. He is gonna die or something bad's gonna happen if nobody takes care of him really, really. It takes him and detox.
And it's not just him. How many more people are going to be taken?
A lot like him. There's a lot of people stuck like him. Yeah.
So anyhow, I'm going to leave it there, and I appreciate you talking to me tonight. And
Thank
we'll
you,
talk
Christine.
some more another time, okay?
Thank you, Christine. Have
And
a great
thank
night.
you. You too. Have a
Thank
great
you.
night.